I'm Uday. I'm a professor of medicine at Armed Forces Medical College, Pune. I'm also a hematologist. Today, I'll be talking and sharing few of our experiences as far as Tocilizumab in COVID-19 pandemic. Cytokines are important in various multi-system organ failure in COVID-19. The most important of them being IL-6 and TNF-alpha. Interleukin-6 can be blocked by using a monoclonal murine antibody, humanized antibody known as Tocilizumab. Tocilizumab has been in the market for last 40 years, wherein initially it was approved and used in rheumatoid arthritis and in psoriasis. Lately, it was also used for last 10 years in cytokine release syndrome post CAR T-cell therapy in hematology practice. With the COVID pandemic, initially in Wuhan, it was tried in individuals after the development of COVID-19, and it was found to have some beneficial effect. Based on these factors, it was then tried in COVINTA trial and in COVACTO trial for use in COVID-19 pandemic and was found to have a beneficial effect. Though the recovery trial has shown a marginal benefit and the multiple RCTs, the meta-analysis has revealed that it was found to have only a partial benefit in overall population, but when we select the patients based on severity and critical illness, and those patients who have got extremely high inflammatory markers, it does benefit in improving the overall outcomes at day 28. The important aspect as far as the Tocilizumab is concerned is to select the patients, and second most importantly, to carefully watch for the various adverse events such as cytopenias, secondary bacterial and fungal infections after giving Tocilizumab, and the hepatic dysfunction. It's also a CYP450 inducer, and therefore it is important to understand that there could be multiple drug-drug interactions in situation like COVID, wherein the patient could be on multi-drug therapy. So choose patient wisely and you will be gifted with a good outcomes in COVID-19 pandemic. Thank you.